All right, let's get right into it. In this explainer, we're going to break down everything you really need to know about a specific sexually transmitted infection called Chancroid. So, here's how we're going to tackle this. We'll start with the absolute basics, what Chancroid even is. Then we'll walk through the symptoms, how it's diagnosed, how it's treated, and we'll finish up with the most important part, prevention.
Okay, so first things first, let's answer the most fundamental question. What exactly is Chancroid?
At its core, Chancroid is a bacterial infection. But, the real defining feature, the thing that really sets it apart, are the painful sores or ulcers that it causes. That's its signature. Now, this gives us some really important context. While it's pretty rare in places like the United States, it's way more common in other parts of the world. But here's the takeaway that I really want you to hear. Having Chancroid, with its open sores, makes it so much easier to both get and spread HIV. That connection is a huge reason why this infection is taken so seriously by health professionals.
Okay, so let's move on and talk about what to actually watch for. How do the symptoms of Chancroid show up and how do they develop over time?
And things happen fast. We are talking about a matter of days here. It starts with these small, painful blisters, but they don't stick around. They break open really quickly, and that's when they form those distinctive open sores, the ulcers, that are the classic sign of the infection. But it doesn't always stop with just those initial ulcers. Sometimes they can get bigger, even merge together, and cause some deeper tissue damage. The infection can also lead to swollen lymph nodes in the groin, creating something called a bubo. And it's important to know the sores aren't always just in the genital area. They can show up in other places too. So that word bubo probably caught your attention. What is it exactly? Well, it's more than just a swollen gland. It's a really tender, painful cluster of lymph nodes in the groin that can actually fill up with pus and turn into an abscess. So now that we have a pretty clear picture of the symptoms, how does a doctor actually confirm that what they're seeing is, in fact, Chancroid? The process is actually pretty logical. It all starts with a physical exam. A doctor is going to look for those specific ulcers we've been talking about. After that, they'll take a small sample of fluid from one of the sores, or a bubo, and finally, that sample gets sent off for testing. The best test they can use is called a NAT, which is just a super sensitive way of looking for the bacteria's DNA. But here's something important to keep in mind. Getting that positive lab result isn't always easy because this specific bacteria can be really hard to grow in a lab. And that's why a doctor's clinical judgment, looking at the symptoms and considering a person's risk, is so incredibly important in making a diagnosis. This quote right here really drives home a critical point. If someone is diagnosed with Chancroid, it's like a huge red flag for other STIs. Because of those open sores, transmitting infections like HIV and syphilis becomes way easier. That's why doctors will insist that you come back 3 months later for more testing, even if you tested negative at first. All right, let's shift gears and talk about the good news, because the treatment for Chancroid is actually very straightforward and it works really well. The infection is cured with a simple course of antibiotics. As you can see, there are a few different options, and most of them are just pills you take by mouth, although sometimes an injection is used. Typically, just one course is all it takes to completely clear the infection. Now, what about those painful bubos we talked about? If they're causing a lot of discomfort, a doctor might need to drain them. But, and this is key, they will only do this while the person is also taking antibiotics. You have to be controlling the underlying infection at the same time. This part is absolutely crucial for stopping the spread. It's not enough to just treat the person with symptoms. Any sexual partners they had in the 10 days before their symptoms showed up also need to be checked out and treated. It's the only way to really break that chain of transmission. And finally, let's talk about what is, honestly, the most empowering piece of this puzzle. How you can actively prevent getting Chancroid in the first place. Now, if these strategies look familiar, they should. They're really the cornerstones of preventing not just Chancroid, but almost all sexually transmitted infections. Things like using condoms consistently, having open conversations with partners, and getting checked out right away if you think something is up. It's all part of taking charge of your sexual health. So we'll leave you with this final thought. When you dig into the details of just one specific infection, you learn its symptoms, you see how it connects to other diseases, and you know how it's treated, it really shines a bright light on why proactive sexual health is so important for everybody. Thanks for joining us for this explainer.